has its ups and downs. Turn your pretty face into an ugly frown. Seems that when I fix one thing.
Hello, welcome to The Awakening. I'm your host, Angela Brown. Today's topic for discussion is periodontal disease. My guest is Dr. Reginald Jones, who's been on the show before, and I received so many cards and letters to have him back, and I have him back today. Welcome back, Dr. Jones.
Nice to see you again.
Oh, you got cold hands. You got a warm heart.
Oh, thank you. Thank you.
Okay, let's get down to business. What is periodontal disease?
Periodontal disease is gum disease, and the old name for it is pyorrhea. That's what our
Pyorrhea?
That's what our parents knew it as. And essentially, what gum disease is the disease process of the gums, the bone, and the tissue surrounding the teeth.
And you mean the disease will rot the bone away in your mouth?
Yes, it does.
Oh my God.
It dissolves the bone away in your mouth.
Okay.
And it's actually an infection. An active infection, just like any other infection in the body, just happens to occur in your mouth.
I see. And why do we get like that?
Usually because the accumulation of plaque and tartar in our mouths contains a lot of bacteria. The average person should go to the dentist at least every 6 months, but if they don't, the tartar and plaque builds up on their teeth, and the bacteria in the plaque and tartar infects the gums.
Yes.
And by having the gums infected, it pours into the body and gets into the bloodstream.
It drains into the body then? Oh.
Yeah, and it affects all the organs of the body. And I'd like to show the audience exactly what gum disease is with some pictures
Go right ahead.
Periodontal disease is an infection of the teeth, gums, and the bone that surrounds the teeth. And it's the leading cause of adult tooth loss. Stopping this condition begins with a thorough diagnosis. The main cause of periodontal disease is the accumulation of plaque, the sticky film of food and bacteria that forms constantly on your teeth. It's hard to see plaque, but look at how it shows up after we've stained it with red dye. The bacteria and plaque invade the spaces between the teeth and gums and begin producing toxins. These toxins, combined with your body's reaction to them, destroys the bone around your teeth. Once bone has been lost, it never grows back on its own. When too much bone is lost, there is so little support for the teeth, they get loose and have to be removed. If you have periodontal disease, you may have some of these symptoms: persistent bad breath, bleeding of the gums when brushing or flossing, soft, swollen, or tender gums, gums pulling away from the teeth, and loose teeth. These are healthy gums. They're tight against the teeth, there aren't any pockets, and they don't bleed. Now notice the difference with early periodontal disease and moderate periodontal disease. You can see the red and swollen infection of the gums. Look especially close at the inflammation of the gums between the teeth. This is where periodontal disease usually starts. It is also possible to have no noticeable symptoms. In fact, most people who have periodontal disease aren't even aware of it. Because of this, we perform a thorough examination with a periodontal probe and X-rays. Periodontal probing measures the depth of the pockets in your gums. We measure the pocket from the bottom of the pocket, where it's attached to the tooth, to the top of the gums. A probe reading of more than 3 millimeters is a sign of periodontal disease. In general, the deeper the pockets, the greater the spread of periodontal disease. Gums sometimes bleed during probing. This is also a sign of infection. X-rays tell us a lot about periodontal disease. This is a healthy mouth. The bone comes up high around the necks of the teeth, and it's even throughout the mouth. This is advanced periodontal disease. The bone level is much lower. Notice how uneven the bone levels are, compared with the healthy mouth, and notice the tartar on the teeth. Tartar shows up on this X-ray as small white lumps on the sides of the teeth. Once we've found periodontal disease, we'll talk with you about treatment options and proper home care to minimize bone loss and restore the health of your gums.
Alrighty, that was quite a tape. I enjoyed it. That was good. You did good work.
Thank you.
Okay, now we were talking about bleeding gums. What can that do to our bodies, our heart, our lungs?
Well, I'm going to answer your question, but the most astonishing thing is that 70% of the people in America between 35 and 45 have gum disease.
Really? And don't know it?
And don't know it. 90% of the people between 55 and 65 have gum disease. And it's one of the most destructive diseases known to man. It damages like your heart.
Yes.
If you have active gum disease, you have a 260% greater chance of dying from heart disease.
Say that again loud and clear.
You have a 260% chance greater of dying from gum disease.
Did you hear that, viewers? Watch this and listen. Okay.
Okay. And so it affects your heart every day that infection goes on in your body.
Yes.
Not only that, you increase your chances of having a stroke by 50%.
A stroke too?
Yeah, by 50%. And these things are caused by the bacteria causes clotting in the body, and these clots can break off, and they can go to the heart.
And they travel.
Yeah, they travel. And if it travels to the brain and blocks off an artery or blood vessel, you have a stroke.
Yes.
And the same thing with your heart. And that's what happens all the time.
And all we have to do is just brush our teeth.
All you have to do is brush your teeth for about 3 to 5 minutes twice a day.
Yeah.
And floss once a day in the evening.
I had heard, it's through another source on TV, that there's 50% odds of your getting diabetes if you're not brushing your teeth twice a day, and heart disease as well if you're not brushing twice a day.
Yes.
And people have said to me, well, Angie, do a show on this, because we all need to know that. But I can honestly say I've never had periodontal disease.
Great.
Because I have an automatic toothbrush, I have a water pick, I floss, and I brush my teeth 3 times a day.
Great.
So, you know, why do you do it so much? Your teeth are pretty. I said, that's why they're staying okay, you know?
That's why.
But you have to worry about your own health. Nobody else is going to worry about you.
Right. And the problem with gum disease is even after you have your teeth professionally cleaned by a dentist or hygienist,
right?
By the next day,
you got plaque starting.
It's already started again.
Because when you leave, you do this, and your tongue feels so good. By the next day, or even 2 days later, you don't have that anymore.
Yeah. It starts right away, actually. Within an hour, plaque starts to accumulate. The good thing is with proper brushing and proper flossing, you can eliminate plaque daily.
What about the foods we eat?
Very, very important.
I'm talking about the drinks, 7-Up and Coke. Oh, I shouldn't even say that. Anyway, but that's sugary, okay? And people think because they're drinking this, that's not going to give them plaque.
Yeah, well, you're going to get plaque no matter what.
No matter what you do.
Those things are worse because the sugar in soft drinks and foods fuel the bacteria. Bacteria grows off the sugar in your mouth. If you're eating sticky candy, that is one of the worst things you can eat.
Really?
Oh, yeah.
Peanut chews.
Yeah, because it sticks to your teeth like glue.
Bit of honey.
Yeah. And so you have all this acid buildup that causes decay and also feeds the gum disease and feeds the bacteria. And every time a bacteria grows, it doubles.
Should we have our cat's teeth cleaned too as well?
Yes.
A friend of mine said, please ask him that question.
Every 6 months, any of your pets, cats and dogs, should have their teeth cleaned every 6 months as well.
Every 6 months?
Because your cat and dog can get gum disease.
Okay.
Yeah, the vet will treat them for gum disease. They'll scale their teeth, and that will make their whole body healthier. So when we talk about gum disease, we're not talking about teeth, as you notice.
Exactly.
We're talking about making the whole body healthier. You mentioned earlier about diabetes.
Yes.
Okay. If you have active gum disease, that makes your sugar level higher.
Really?
Yeah.
I didn't know that.
Yeah. It makes you more susceptible to infections if you have gum disease. And it's harder to treat your diabetes if you have active gum disease.
Right.
Some studies have shown that after a person received treatment scaling, that it's almost like, with diabetes, it's almost like they took insulin. The blood sugar level drops.
Oh, I have a sister, she's the oldest of us 3 girls, and she was probably in her 30s and never took care of her teeth, and she ended up losing every tooth in her mouth. Gosh. And she was fitted for some good teeth because I paid for them, and she doesn't like wearing them because she doesn't like the way her mouth feels, so she goes without teeth.
Yeah, well, they don't fit anymore.
I've had them lined twice for her already.
But remember, she lost all that bone. She lost all that bone because she didn't get implants.
Okay.
Yeah.
That's the
So, and
point.
at 30, that's very young to lose your teeth. So she's had.
She never took care of her teeth her
Yeah.
entire life. You used to
Yeah.
make fun of me for doing mine so much.
Well, yours look great now. So you've done a
Thank
good
you.
job.
I try to take care of my whole body, not just my teeth, because we all go together.
Yes.
All the organs go together.
That's right.
So I guess I better take my cat to the vet.
Right away, and after that, every 6 months, and the cat will feel better. And there's snacks in between your visits that are a little harder to chew. And when you talk about foods, the same thing with people. Soft, sticky foods like bread, pasta, those things are
Biscuits
gonna.
and cornbread and stuff
Oh
like that.
yeah, they're yeah.
Don't you like cornbread? I love
Oh, I love it.
cornbread.
I love the biscuits too. I love
I
all
like
that
biscuits
stuff.
too.
But you know what? It's great if you eat a piece of fruit after you finish, or even
Yes.
better, your salad.
I'm a salad eater. I love salad.
Because the roughage and the mechanical action of the salad will help remove some of the plaque.
Okay, what else can periodontal do to our bodies?
Well, for our younger audiences, it can cause low birth weight babies.
So if a woman is pregnant and has periodontal disease, her baby could have low weight.
Yeah, if she has periodontal disease, her chances of having a low birth weight baby is 7 times greater
Oh my God.
than a woman who doesn't have gum disease.
How often should we have our children's teeth brushed the first time?
How often or cleaned?
Oh, let's just say when a baby is, say, 2 years old,
Yeah.
teach them how to brush, or before that age?
Yeah, I think you should be brushing their teeth the moment they start getting
True,
teeth. And
true.
what we recommend when they're very young is you take a nice warm cloth, put a little toothpaste on it. They have toothpaste for infants, no fluoride in it, and you just wipe the teeth off. And then by the time they're 2, then it's nice to put them next to you, sit them on your lap or next to you, and you brush. And of course, we have baby toothbrushes, and
Yes.
then they can also brush.
Well, notice you have a couple of parts here of the teeth. Which way is the best? Because some people do like this, some do like this. So what is the correct way to brush our teeth?
The correct way is to hold the toothbrush at a 45-degree angle, and we call that sulcular brushing.
Succular brushing.
Yes,
Never heard that before.
because between your tooth and gum, there's a space called the sulcus, and that's where the gum disease starts. That's where all the bacteria goes in.
That's where it hides.
Yeah, and that's why when we eat food, that's where it goes. So it's very, very important that people brush at least twice a day for 3 to 5 minutes.
Now, let me ask you this. What about these preparations, like some kind of stuff you take to remove the plaques off your teeth before you brush? Is this or is this not a good thing to do? I don't want to get you in a bind.
Right, it's the best thing to do, and I'll come back, is to brush and floss. Brush and flossing will actually remove just about all the plaque and tartar from your
Okay.
teeth. The other items that you're talking about, we have things that are prescriptions that work really well, that work, but the stuff I see advertised on TV that you buy, they do very little.
They do very little. I won't buy this stuff anymore.
Yeah, they do very little to remove plaque. They really do. But there's some studies that people have done when they talk about longevity of life. And one thing some of the researchers were smart enough to identify is that if you can control the destructiveness of gum disease, you probably can add 5 to 7 years to your lifetime.
Really?
5 to 7 years.
5 to 7 years.
Yes.
How long does it take periodontal disease to go away? Because I know it can come back.
Yeah. Well, if you get gingivitis, which only affects the gums and does not cause any bone loss, that's gingivitis. Even teenagers have that.
Okay.
That's curable, very easy to treat. But once you get periodontitis or bone loss, which means the bone has dissolved away.
You mean the bone just dissipates?
Yes, literally disappears.
Okay.
And if untreated, you will lose your tooth, literally,
Right.
to gum disease. 80% of the adult tooth loss is due to gum disease.
Oh, I see.
80%.
If you catch it early, can you have some kind of bone done, something to build your bone back up so you won't lose that tooth?
Not really.
You can't. You don't use that, huh?
You can do it in localized areas, but in general, no. Once you lose bone, the bone is lost.
It's not going to grow back.